Hi, in this video, I'm going to talk about the damage of diabetes on your body, help you treat diabetes more easier. As you can see, diabetes can damage your kidneys and affect their ability to filter waste products from your blood. If your doctor detects microalbuminuria, or elevated amounts of protein in your urine, it could be a sign that your kidneys aren't functioning properly. Well, kidney disease related to diabetes is called diabetic nephropathy. This condition doesn't show symptoms until its later stages. If you have diabetes, your doctor will evaluate you for nephropathy to help prevent irreversible kidney damage or kidney failure. You know, diabetes raises your risk of developing high blood pressure, which puts further strain on your heart. When you have high blood glucose levels, this can contribute to the formation of fatty deposits in blood vessel walls. Over time, it can restrict blood flow and increase the risk of atherosclerosis, or hardening of the blood vessels. According to the National Institute of Diabetes and Digestive and Kidney Diseases, diabetes doubles your risk of heart disease and stroke. In addition to monitoring and controlling your blood glucose, good eating habits and regular exercise can help lower the risk of high blood pressure and high cholesterol levels. Well, you should also consider quitting smoking if you're at risk for diabetes. Diabetes and smoking are a very bad mix. It increases your risk for cardiovascular problems and restricted blood flow. In fact, lack of blood flow can eventually affect your hands and feet and cause pain while you're walking. This is called intermittent claudication. The narrowed blood vessels in your legs and feet may also cause problems in those areas. For example, your feet may feel cold or you may be unable to feel heat due to lack of sensation. This condition is known as peripheral neuropathy, which is a type of diabetic neuropathy that causes decreased sensation in the extremities. It's particularly dangerous because it may prevent you from noticing an injury or infection. Diabetes also increases your risk of developing infections or ulcers of the foot. Poor blood flow and nerve damage increases the likelihood of having a foot or leg amputated. If you have diabetes, it's critical that you take good care of your feet and inspect them often. Diabetes can also affect your skin, the largest organ of your body. Along with dehydration, your body's lack of moisture due to high blood sugar can cause the skin on your feet to dry and crack. It's important to completely dry your feet after bathing or swimming. You can use petroleum jelly or gentle creams, but avoid letting these areas become too moist. Moist, warm folds in the skin are susceptible to fungal, bacterial, or yeast infections. These tend to develop between fingers and toes, the groin, armpits, or in the corners of your mouth. Symptoms include redness, blistering, and itchiness. High-pressure spots under your foot can lead to calluses. These can become infected or develop ulcers. If you do get an ulcer, see your doctor immediately to lower the risk of losing your foot. You may also be more prone to boils, folliculitis, styes, and infected nails. However, diabetes causes diabetic neuropathy, or damage to the nerves. This can affect your perception of heat, cold, and pain. It can also make you more susceptible to injury. The chances that you won't notice these injuries and let them develop into serious infections or conditions increases, too. Likewise, diabetes can also lead to swollen, leaky blood vessels in the eye, called diabetic retinopathy. This can damage your vision. It may even lead to blindness. Symptoms of eye trouble can be mild at first, so it's important to see your eye doctor regularly. In fact, the changing hormones during pregnancy can cause gestational diabetes and, in turn, increases your risk of high blood pressure. There are two types of high blood pressure conditions for pregnant women to watch out for: preeclampsia or eclampsia. In most cases, gestational diabetes is easily controlled and glucose levels return to normal after the baby is born. Symptoms are similar to other types of diabetes, but may also include repeated infections affecting the vagina and bladder. That's going to be the video. Thanks for watching, and don't forget to click link in description below to learn more about how to lower your blood sugar and heal diabetes easily.